Bismillahirrahmanirrahim. I'm Dr. Javed Iqbal Kokar, Professor of Forensic Medicine. As I'm discussing traumatology, and this is the fourth lecture on these mechanical injuries. And the contents of the talk will be that as we had started discussion on the injuries which are caused by blunt forces or blunt weapons, which are basically the abrasions, the contusions, lacerations. And in the previous lecture, we discussed about the abrasion, and now I'll talk about the contusion or the bruises. What is the cause and effect relationship, how it appears regarding the shape, what is the size of the bruise, what is the appearance, how it looks like, what is ectopic bruising, delayed bruising, and various medico-legal aspects related with the bruising. So starting with the topic, injuries caused by the blunt forces, blunt objects or the blunt weapons, they are the contusions. Abrasion we have discussed and laceration we'll discuss in the next lecture. So today, contusions. They are also called bruises or contusions. And bruise is basically an area of discoloration due to extravasation of blood in the subepidermal layers of the skin due to rupture of small blood vessels by the application of blunt force. So that means the force being applied is blunt. Blunt that is offering a broad surface to the area of the contact, and the superficial skin remains intact, and the underneath skin the vessels they get ruptured and the blood comes out of the vessels and it collects in the subepidermal spaces, and this appears as discolored area, and that is bruise. So bruise is a discolored area because of the collection of the ruptured blood vessels due to application of blunt force or blunt weapon or blunt object, and without breach in the integrity of the tissue or the covering. That means the skin remains intact and underneath there is collection of blood. Now about the cause and appearance or cause and effect relationship. And cause mean the responsible thing, blunt weapon, blunt object. That means cause in bruise is blunt weapon, and effect will be the discolored area, the bruise. So cause is the application of blunt force and the effect is the discolored area which appears as bruise. So the cause is the blunt force or the forceful contact or the forceful impact or combination of those. So forceful contact means the pressure is applied and impact with the movement. So contact, when it is in contact and force is applied, and impact is when there is movement or combination of those. So this is the cause, and the appearance is the area of discoloration because of this impact. Now the cause, sudden severe application of pressure to the soft tissue due to impact, forceful contact or combination of both, and the appearance will be area of discoloration. Now some important things which are to be remembered in bruise. The word bruise and contusion, these are two synonymous terms which are used. I will explain them. Then regarding its shape, regarding its size and the appearance. So these things we have to look into detail. So regarding bruise or the contusion, although these words they appear synonymously, but there is a difference in these words. Bruise is said to be present when it is visible through the skin. So that means bruise is present on the surface of the body, on all the surface of the body which are covered by the skin, whereas the contusion is on the viscera, that is the viscera which are inside. When there is appearance of application of blunt force and the covering of that viscera remains intact and there is collection of blood underneath its capsule or its layering, then that is called contusion. So skin is bruised and the viscera is contused, and that viscera may be kidney, liver, intestine. So this is the difference between two terms. So skin is bruised and the liver is contused. Now regarding the shape of the bruise, as bruise is due to extravasation of the blood and the extravasation is due to rupture of the small blood vessels, and the shape is variable. You cannot comment upon the uh, shape of the bruise. How will it appear? It will again be dependent upon the amount of force which will be applied and who has caused the rupture of the blood vessels. So the shape is variable and there is no definite shape of the contusion. Now regarding the size, the same rule applies here, that size can vary from pinhead size to a large hematoma. So it's also variable. So pinhead, it is called petechiae, and when it is combination of petechiae, it is called ecchymosis, and larger bruise, that is called as hematoma. There is frank collection of blood, that is called as hematoma. Now regarding the appearance of the bruise, the fresh bruises may not show any color immediately when there is bruise, but it is painful swelling. So immediately there will be swelling and pain. However, there can be ectopic bruising or delayed bruising. These are other terms, we'll discuss them. The ectopic bruising is sometimes the extravasated blood travels along the lines of the dependent part. For example, if the injury is on the top of the head and the blood, because of the effect of the gravity, will flow down underneath the scalp and will be collected around the eyes. So that will take some time to develop, and that is called as delayed bruising. So the blood flows down under the effect of gravity and collect at some distant site. This is known as ectopic bruising. Then that means away from the site of application of the force. The force has been applied on the top of the head, but the appearance of the bruise is on the eye. So that is ectopic bruising. For example, the example which I was giving you, that is appears as black eye. When there is blunt trauma to the head, the blood gravitates to the eye and it is called as black eye. So this is the diagrammatic representation, that from the forehead the blood is flowing down around the eye and how it appears. This is a picture showing the black eye. Same picture showing the black eye. Then regarding the delayed bruising, sometimes there is extravasation of blood in very deep tissues and it will take some time to become visible to the superficial surface. And this time lapse is because the uh, visibility is delayed, and that's why such bruises which are deep and appears late, they are called as delayed bruising. Ectopic bruising is appearance of bruise away from the site of impact. Delayed bruising is appearance regarding time. After some delayed time, it will be appearing. These are the various types of bruise. Now the factors which change the appearance of the bruise: age, sex, type of tissue involved, vascularity of the area, color of the skin, and presence of some natural disease. So we'll discuss one by one. Regarding the age, in infants and children, because of the tenderness of the skin, the bruise appear easily. And in old age, because of the loss of fat, the fresh bruise also appear easily. Regarding the sex, in female they are more having soft tissues and fat as compared to male, hence they bruise easily. So the bruises appear easily in female as compared to male. Now regarding the target area or area involved, the tissues on which there is application of force, on areas where the skin is tightly attached to the deeper tissues like the palm of the hands or the soles, the appearance of bruise will not be as prominent as in other loose and lax areas where the blood can be collected. Then, whereas in areas where the skin is loose and lax, bruise will appear prominently. The extravasated blood may travel along the tissue lines and settle in those loose and lax areas. This is another ectopic bruising. We have discussed this. Now, regarding the vascularity of the area, the areas which are more vascularized will show bruising easily. And regarding the color of the skin, in fair colored skin persons, the bruises will be easily visible as compared to the person with dark complexion. Now, about some natural disease. If there is some natural disease of blood or blood vessels where there is the possibility of bleeding easily, or when there is bleeding time is shortened, or the clotting time is shortened, or other diseases of the uh, blood, they will bruise easily than as compared to the healthy individuals. Now, regarding the medico-legal aspect of the contusion, we have to determine the bruise time, age of the bruise, how old it is, and with the naked eye, when we examine the bruised area, it is from the color changes. The bruise will be showing color changes, and from those color distincts, we can estimate the age of the bruise or the time of infliction. The color changes, it starts from periphery towards the center of the bruised area. And this is because of the degradation or the breakdown of hemoglobin by the tissue enzymes and the histiocytes. And these pigments, the hemoglobin breaking down into various pigments, they show various colors. So hemoglobin, it is reddish, and when it breaks down, it converts to hemosiderin, to brownish color, and then this brown color hemosiderin is converted into hematoidin, which is green in color, and then hematoidin, which is green, is converted into bilirubin, which is yellow, and finally the bruise fades away. So the changes in the color of the bruise with time, they are fresh, they are appears as red. After 24 to 48 hours, they turn reddish blue, and in 2 to 4 days, it is purplish or bluish black, and in 5 to 7 days, it is green in color, and in 7 to 10 days, they appear as yellow. And this is how it appears. You can see the variation in colors, variegated colors of the skin. This is another picture showing the variation in the color. So the contusion fades away and disappears in about 15 days, and when the pigments are removed by the phagocytes. So there is no area of discoloration left after about 15 days. The sequence of color changes varies from person to person and from wound to wound. That means the amount of blood, if it is more, then naturally it will take longer time to get it cleared. And similarly, if it is deep, it will again take longer time. So it varies from wound to wound. Therefore, it is not it is an approximate. We estimate an approximation, and it is not a confirmed days and date. So we just give an approximate time. Now we can also determine the age from the microscopic examination, and these changes will depend upon the detection of the pigments. And these pigments, the hemosiderin, bruise not less than 3 days, hematoidin at least 5 days old, and bilirubin in 7 to 10 days. So these are various pigments which we can detect microscopically and estimate the age of the bruise. Now regarding the antemortem and postmortem, this is another medico-legal aspect. We have to determine whether this injury was inflicted when the person was alive or this has appeared after death. So in antemortem bruising, the margins are always blurred due to vasoconstriction because this is an vital reaction. Person was alive. And in postmortem, the margins are sharply defined. In antemortem, the extravasation of blood in the skin and the subcutaneous tissue, it causes deep infiltration and staining of the tissue and cannot be washed. That means the extravasated blood, it stains the tissue and it is organized there. And if you try to wash it, it will not be washed away. And if we have to differentiate between antemortem and postmortem, you simply give an incision there, and if there is blood has been clotted and is organized, fixed with the tissue, it will not wash away. Whereas the postmortem bruise, it will be easily washed. The blood has not been organized. So in the postmortem, there is no extravasation of blood in the tissues, but due to passive pooling of the blood, and which can be easily washed with water. And the antemortem bruise show changes in color, and there is blanching not seen. You press the margin, it will not blanch, whereas the postmortem there is no color change and blanching will be present. This is the cut section. If you are in doubt, you simply wash it and there will be no vital reaction in the postmortem bruises. So this is the bruise. It can be on anywhere, any surface, front, side, back. So that how it distinct from the postmortem lividity, which is on the back. Now regarding the manner of infliction, most commonly bruises are accidental or homicidal, but are never self-inflicted or suicidal because lot of force has to be applied. So by careful examination and going through the history, we can differentiate whether the manner of infliction is accidental or homicidal. Police torture is a common manner of infliction of bruises, but they are on elective sites. So we can differentiate the sites for the police torture. They are commonly on the buttocks, the hands, and the sole of the feet, because in the hands and the sole of the feet, the skin is tightly bound to the deeper tissues, and the blood will not be appear and collected, and there will be no distinct color variation will be visible. So at the sole of the feet and hands, the skin is tightly attached with the underlying tissues, and bruise appears late, but they are very painful. Regarding the self-inflicted bruises, they are rare, but when bruises are produced, blood vessels are ruptured, and this needs extreme amount of force. So that's why they are rare. But sometimes the artificial bruises can be made. Similarly, the trace evidence on bruise, it will help us in distinction of the site. The bruises along with other trace evidences like sand, mud, dirt, it will give an idea of the place of incidence. This is about the artificial bruise. Sometimes the artificial bruise can be produced by application of some irritating object, and most commonly the marking nut is used. and it is very irritating, but there will be blister formation due to that irritation, and we can easily differentiate that some irritating material has been applied to produce this color change. So it can easily be distinguished. Now regarding the kind of weapon, sometimes the shape of the contusion gives an idea about the type of weapon used, like the tram line bruise or the tram track bruise. These are with the sticks. Whenever there is application of stick, the tram track or tram line bruises are formed. And this is a characteristic shape appearing by hitting the stick, the whiplash, or the metal rod. And contusion, it appears as two parallel lines of hemorrhages and a pale line in the center. And the area where the blow is produced will be pale in the center because the blood has been displaced toward the sides. And in the center, there is stick that is pale and blood has been displaced to the sides. That's why the two red lines you can see here. The center is pale and the sides are reddish. This is a diagrammatic representation that stick is applied in the center is pale and this blood has been displaced to the sides appearing as the tram track or the train lines. Sometimes the object gives an imprint. For example, this is a shoe and it appears as imprint on the surface of the skin. Similarly, the six-penny bruises, they are produced usually the homicidal throttling, and they are about the size of six-penny, and they are because of the pads of the fingers and the thumb, and they are grasping the neck from the front and the sides, and these pads of the finger will be giving the six-penny bruises. Now regarding the complications or the pathophysiological effects of the bruises, infections can be there, shock can be there, fat embolism can occur. Regarding the infections, as contusion is a closed injury, so chances of infection are rare. But sometimes if they are associated with other injuries, then infections can occur. And bacteria can enter from the body, they reach to the site of contusion and where they grow and produce infections. And sometimes they produce the gangrene. Now regarding the shock, hypovolemic shock is not normally present, but if the area involved, if they are multiple and massive contusions and involving the large area of the body surface, which is more than 25% of the body volume, that the length into breadth into depth, that is more than 25% of the body volume, then it is sufficient to produce the shock. Then the hypovolemic shock can occur. There is loss and extravasation of blood, protein, serum from the blood vessels, and as a reaction causing reduction in the blood volume, that will produce shock. Now regarding the fat embolism can occur. This is due to compression of the fat. Small fat droplets may enter into small capillaries and can cause fat embolism. So thank you very much. This is all about contusion. In the next lecture, we'll continue with the lacerations.